So can I ask Andrey Zhigalo to come and tell us about a classification for Dupuytren's disease?
Dear colleagues, I'm glad to see you all. My report will focus on classification of Dupuytren contracture. Globally, the Tibiana classification is widely used, in which consists 4 stages depending on the flexion angle. A modified version of this classification introduced 2 initial substages: N0 presents the palmar nodule without extension limitation, N1 flexion restriction ranged from 0 to 5 degrees. This classification has certain limitation, difficultly visually distinguishing 0 to 5 degree, fails to account for hyperextension limitation, alters the traditional Tibian stage 1 definition. We propose a modification to retain Tibiana classification unchanged. We introduce 2 substages. Stage 0 presents only nodules without motion restriction. Stage 0.1, any hyperextension limitation from 0 to negative value. This division, stage 0, simplify classification and preserve the globally recognized 4-stage Tibiana angle. This clinical example for stage 0 and stage 0.1. Photo before and after needle aponeurotomy with collagenase. Stage 1 according to classical Tibiana classification, photo before and after PNF. Stage 2, before and after PNF. Stage 3, before and after PNF. Stage 4, and same before and after PNF. We develop template. We develop a template that you can download and print on the standard printer. Place the template on your office desk and align both of the patient left and right hands to determine the stage of Dupuytren contracture without angle meter. Another goal, what we set ourselves, was to encode diagnosis Dupuytren contracture in the form of hashtag for use the internet. What we do encoding: right to left hand, 1 to 5 chords affected, joint involved in the contracture flexion angle according to Tibiana classification. Joint involvement coding: only MCP joint affected. Palmar form, P comes from the Latin palma, palm. Only PIP joint affected. Digital form, D comes from the Latin digitus, finger. Both MCP and PIP joint affected codes as P plus D, palmar digital form. All joints affected, total form, T from the word total. Dupuytren contracture is spelled and pronounced differently across languages, often causing confusion. Our coding system allows a global understanding like music without translation. Now I will demonstrate how this works using the clinical case incorporation classification parameters. This slide shows left hand, letter L, 5th chord struck 5C, MCP and PIP joints affected, so that's PD and Tibiana classification, 3rd stage. What's the peculiarity of our classification? In fact, it's not different from the Tibiana classification. For convenience, we divide only the 0 stage into stage 0. Only nodules are present, no motion restriction. Stage 0.1 presents a chord and hyperextension limitation from 0 to negative value. All the stages remain unchanged following the classical Tibiana classification. We have made an application what allows the encoding diagnosis based on photo on the hand. To this, you just need to upload the photo. Can you do it yourself now using the link from the screen? In the photo, you need to specify the point of the joints, and the program will create code of determine of stage of Dupuytren disease. This diagnosis code can be used as hashtag what they upload in the social network and placed any database. By encoding the diagnosis, we can more easily find contracture we need, analyze the treatment results. Now let me conclude the report with the clinical example of the treatment of Dupuytren contracture of the extreme 4 stage. After needle aponeurotomy, we received practically no significant active motion. I'll touch all the chords we eliminated. The patient underwent 1 month of the hand therapy. Night splinting was applied. As a result of joint efforts between the patient and therapist, a good functional outcome achieved, demonstrated on this slide. This is my poster presentation with my colleagues. We are waiting you everything during the break for discussion. Thank you for your attention.
Any questions for Dr. Zhilago? Paul?
Beautiful presentation. Thank you very much. I just have one comment. You have to be careful if you include 45, 90, and 35 as the end of
okay.
measurements, all your scores.
Thank you.
45
Yes.
can be 1 and 2. Okay?
Okay, thank you.
I'm using this qualification for not choosing radiotherapy. Because when patients come and have diagnosed Dupuytren, they get afraid and shocked by the internet and the images. So we examine them and we actually measure the so-called O extension test by making the MCP joints fixed to the board and measure individually the lift up of the fingers, 41, 32 millimeters, make this available for the patient, and so the patient himself will measure these dimensions. And so I say, you don't have Dupuytren contracture, you have only Dupuytren disease. And you also are afraid to be afraid for contracture, so we don't need you to treat. So follow up 6 months, 12 months, and if this overextension diminishes, we start, because it's a proven progression in the face of home zero. But don't treat, don't give radiation in the other face.
Thanks.
Okay, if there's no more questions, thank you very much.
Thank you very much.